Hey guys, welcome back to my channel. Today I'm going to be doing my 31 and 32 week pregnancy update. Just putting them together kind of because, like I said last time, there wasn't much has changed, but a little bit has this time, so I'm just going to put these two together. So let's just get started. At 31 weeks, they say your baby is the size of a coconut, and now I'm 32 weeks and they say the baby is the size of Napa cabbage. So that's what they say. They say they can weigh up to almost 4 pounds now. Okay, it says his eyelashes, eyebrows, and even the hair on his head are now all in place. Started shedding those fine hairs that cover your baby's body, and most of it will be gone by now, though some babies are still born with a little. Your baby may be standing on its head now or sometime soon. My baby is. My last appointment was 2 weeks ago, and they felt for him and they said he was head down. So they said he most likely would just stay that way. It says most babies move into the head down position at least a few weeks before birth. Don't be surprised though if your little one decides to change positions several times before he's born. So like now, he can go from being head down like he is, turning around and going head down again, and blah blah. So let's see. More and more fat is forming under your baby's skin. This has now turned into your baby's skin from see-through to current state. So it's not see-through anymore. That's not all. Your baby's toenails have been growing and are now visible. Those little clippers, get those little clippers ready. You'll be cutting those tiny nails soon enough. How big is your baby at 32 weeks? Now that you are 32 weeks pregnant, your baby weighs around 3, almost 4 pounds and measures around 11 inches crown to rump. So obviously not from last time I told you from head to toe. This is measuring from his head to his butt. This makes your baby about the size of a Napa cabbage. Okay. Mom's body at 32 weeks pregnant. It says during pregnancy you may experience changes in your mouth, teeth, and gums that might cause discomfort. These may include sensitive gums. If your gums feel more sensitive or if they swell or bleed when you brush or floss, it might help to rinse with salt water or use a softer brush. For me, this is true. Actually, it's something new. When I started brushing my teeth, like my gums would bleed a little bit, which never happened to me before, so it's just something I brought up with my OB, and he said it's normal, and he actually did suggest rinsing with warm salt water or using a softer bristle brush, and they'll look more into it, like if it continues to happen after you have the baby. But right now it's normal. Like it's nothing that you should have to go to the dentist for or anything like that unless it's severe. Teeth feel looser. Hormonal changes can cause your ligaments to relax, and these same hormones may also affect the tiny ligaments that hold your teeth in place. As these ligaments relax, your teeth may feel looser. Rest assured, it's unlikely you'll actually lose a tooth for this reason, and this feeling usually goes away by the time you've given birth. So for me, that's not true. I don't really feel like my teeth feel loose or anything like that. So that's not true for me. Mouth sores. You may get these sores because your immune system is working overtime to remove germs from your mouth. The good news is that the sores typically go away after pregnancy. So for me, I haven't got any sores in my mouth, but obviously everybody's different. That's just something for me that hasn't happened yet or may not happen. It's important to floss daily, brush twice a day, and keep up with your regular dental checkups every 6 months. Okay. This says 32 weeks pregnant, your symptoms. So leg cramps. You've been experiencing sharp pain, cramps in your calves or legs. You're not alone. Unfortunately, this is a common symptom of late pregnancy that's not known why, but try to stretch out your legs before going to sleep at night. If you experience a cramp, flex your foot forward and backwards and massage your calves, downward strokes. This should help. For me, it's not so much leg cramps, but I do get restless legs. Like I can't get comfortable no matter how I sit. Like I just, restless leg syndrome. That's what it kind of feels like I have sometimes, but I don't think that it's painful. I just think that it's uncomfortable. Okay. Diarrhea. It's never pleasant, but you could come down with a bout of diarrhea at 32 weeks pregnant or at any time. If this happens, make sure to drink plenty of water to stay hydrated. Sometimes diarrhea can also be a sign of preterm labor. So if you notice any symptoms like abdominal cramps, pelvic pressure, low backache, regular contractions, or your water breaking, obviously contact your healthcare provider immediately. So no, I definitely wouldn't say I have that at all, any of those symptoms. But let's see. Pregnancy brain, in quotation marks it says. You might have heard of this and wondering whether symptoms like forgetfulness and difficult concentrating are actually caused by pregnancy or whether you're just imagining things. So pregnancy brain for me is definitely true to the sense. I do think that it is real because I don't really act like this when I'm not pregnant. This like mistakes or forgetfulness that you do. Like I'll be putting something like cereal away and I'll put the cereal in the fridge and the milk in the cabinet, like stuff like that happens. Or I'll forget easy things or write down like it's 2014 when it's 2019. Stuff like that definitely happens to me. It can be very frustrating, honestly. Okay. 32 weeks pregnant, things to consider. Be on the lookout for symptoms like sudden weight gain, persistent headaches, changes in vision, pains in upper abdominal or shoulder, and swelling or puffiness. These could be a sign of a pregnancy-related high blood pressure disorder called preeclampsia. If you notice any of these symptoms at 32 weeks pregnant or at any time during your pregnancy, contact your healthcare provider right away. So I definitely would say that I have swollen feet. Like I said in my last video, I have a swollen face, feet, hands, stuff like that, which I did, they look at it, it's fine. It's for me personally. But it can be signs of that, so I would definitely, if you have it at all, just, even if you don't think it's anything, just let them look at it just to be sure. Okay. Okay. 32 weeks pregnant, your healthcare provider may be asking you to keep an eye on your baby's movement. Your provider will be able to provide direction that they suggest is doing kick counts. Every so often, you should be feeling, like I said in my last video, you should be feeling 10 kicks per hour at this stage at 32 weeks. So definitely 10 kicks in an hour. Pick a time of the day when your baby is typically energetic. For example, if you've just eaten a meal or drink something cold, lay down and do kick counts. Okay. At 32 weeks, you are 8 months pregnant, depending on how you're grouping the weeks pregnancy into months. Although you still have a ways to go until your pregnancy is full term, you'll have a lot on your plate in these final few weeks to make life a little easier. Like I said, those symptoms, I'm just going to kind of touch on this new symptom that I've had, and it's called, I don't know what it's called, but I talked to my OB about it, and it's like this pain in my groin area. Like if I try to sit down on the couch and like bend my knee, or if I try to stand up and walk, roll over, basically anything, I was having this horrible like aching pain. It wasn't sharp like lightning crotch like people say. It was like this dull achy pain. Like it was horrible. Like I couldn't do anything, couldn't roll over, it was just really bad. And my doctor said to just take it easy, like not walk as much, or like don't carry heavy stuff up the stairs, like don't do too much, because that is what caused it. He said when you get out of bed to sit up first, don't get straight up, just sit up first, take your time, drink a lot of water. So I started drinking more water, and I stopped overdoing it. I started drinking more water, like I said, and it's gone down a lot. I wouldn't say that I won't go completely away, but it definitely did help. So if you're having those symptoms, I would just drink more water and stop overdoing it. Get help if you can get help carrying stuff up the stairs or carrying heavy stuff. Or do, like he said, don't bend down a lot to pick stuff up. He's like, just really take it easy. And another thing he suggested to get was a belly band that lifts up your belly, which definitely I would agree with, to definitely get that if you're having that symptom. Just some extra symptoms they tell you to look out for, or that are normal, basically, just that happen. More Braxton Hicks contractions are basically just practice contractions, like I've mentioned in a few videos. I do get them sometimes, but they say if you get them, like take a hot bath or something, and if they go away, they're not real contractions. Or if they're not consistent and get like stronger and close together, they're not real contractions, like labor contractions. They're just practice contractions. They say you can get darker nipples. It says suddenly your areolas may look darker. No one knows exactly why, but one theory is they darken so that baby can see them better for breastfeeding. Your body is pretty amazing. All right. Shortness of breath. It says don't worry, baby is getting plenty of air. You're not though, so don't push yourself too hard. I definitely would say I have shorter breath. I've mentioned that before. Basically anything makes me feel like I can't breathe. Heartburn, like I said, is my biggest symptom out of before that I had this pain in my groin area. It was my biggest symptom for sure. Like, it's still going on, it's still constantly, it's horrible. So we'll see if the wives' tale about baby having a lot of hair is true or not. Leaky boobs. Your breasts are probably noticeably bigger, and they may have even begun to produce colostrum, which is a thick yellow fluid that baby will eat in the first few days of life. Don't be surprised if you see a little bit leaking at this point. So it's definitely, since my last update, it has been happening more often, but not enough to like soak through your shirt or anything like that. With my first son, I didn't leak at all or have anything at all until after I had him. So I know every pregnancy is different, obviously, because now I am, and I'm 32 weeks. So I'm sure it'll just keep getting more and more as I get farther along. Your belly should measure about 30 to 34 centimeters from the top of your uterus to your pelvic bone. So at your appointment, that's why they take that little measuring tape and they measure from your pelvic bone to the top of your stomach. They did, and they said he's measuring exactly what he should be. So that's awesome. It says baby's getting ready for his or her descent, and as we mentioned, is likely head down now. He or she probably feeling more cramped. You'll probably have a 32-week pregnancy checkup. Most OBs like their patients about every other week at this point in pregnancy, which is true. I am going every 2 weeks now. You probably won't have a 32 weeks pregnancy ultrasound though, unless you have pregnancy complications or there's something specific your doctor wants to check for. For example, for women who are 32 weeks pregnant with twins, the doctor may want to perform an extra monitoring on from 30 weeks on. So my last ultrasound, I believe, was when they did like for a movement or something like that, which was because I wasn't feeling a move as much. So they did it, but anything like scheduled, I think, was my anatomy scan. That was my last like scheduled ultrasound that you need to get. I'm not sure if they'll do any more or not. They haven't said. I have an appointment in a few days, so we'll see what they say. So just a checklist says schedule your 34-week prenatal visit and install baby's car seat, which I'll be doing in a few weeks. I have 8 weeks left, so I'll probably do it in like 3 or 4 weeks just to be safe. But that is basically all I have for this update. I'll probably continue to do every other week, not every week for the updates, just because, unless something changes super big, which I did get my results back from my glucose test, and I passed my 3-hour one, so that's super good. So my next appointment, he will probably basically just discuss that I passed that, measure my stomach, weigh me, take my blood pressure, ask if I have any questions, and then schedule for another 2 weeks. So that is pretty much it for my update, and I will see you in my next pregnancy update video.